opting to use the handheld. I'm kind of used to that. We use these a lot in the Black church. So I'm just going to go with that. All right. So as she's setting up, it's just really great to be here and just learning for the last 3 days on Black mental health. My name is Dr. Lee Brown Spencer. I'm from Toronto. I'm what I call myself an eclectic academic. I wear a lot of different hats. As much as I teach in the Faculty of Social Work at York, I'm also a producer, playwright, and very immersed in the arts. And I've used the arts as a way to educate, particularly in faith-based communities, where often I find a sense of, I don't want to say hiding behind our faith, but sometimes difficult issues, you can use theater and music and all different arts forms to really communicate a message in a way that's kind of heard. And so mental health as the church's business is a title that I use that I was funded under the public health to do under the incubator stream, engaging Black churches in Canada. And so just to begin, I do want to do a little bit of historical grounding in terms of what I mean. What's the historical significance of the Black church? And then I'm not going to follow the research findings and stuff like that. I just wanted to use my arts background and kind of just talk. Is that okay? I'm sure you've heard a lot of research methodologies. Unfortunately, I've done that, but that's not what I'm here today. I'm here to bring you into a window of erased history. I believe there's an erasure of history, of Black Canadian history here in Canada in terms of the role of Black churches post-1950. There's a lot of literature. If you go to eastern parts of Canada, through Nova Scotia, the Underground Railroad, a lot of literature in there in terms of the Black experience. But after the 1955 West Indian domestic policy that the Liberal government at the time had pushed through, we saw mass influx of Caribbeans coming into Canada. And the amount of trailblazing and significant inroads they made into liberalizing immigration policies, ensuring that Black communities were taken care of, a lot of that was through the Black leaders from faith-based communities, believe it or not. And so I wanted to kind of capture that. When I did my PhD years ago, I'd done a lot of research in terms of sitting down with a lot of elders. Most of them are now deceased. And I just want to kind of bring you into that window today. The Black church in Canada is very much underrepresented in scholarship. Yet they've nurtured the socio-political, economic, spiritual, and well-being of Black people. So this initiative, Mental Health as the Church's Business, was developed in response of the Black church and mental health, the absence of the Black church in mental health spaces, and the vast underrepresentation of the enduring role that Black churches have played historically in the function, information, and the defense of Black communities in Canada. Basically, when we talk about the inhumane racial trauma, white supremacy that Black communities have endured across North America, they continue to grapple with the consequences of post-colonial era. And so the overrepresentation of Black people in the criminal justice system, stark health disparities, low socioeconomic status, right? All of these are direct results of historical anti-Black racism. And before we were using language of anti-Black racism, you found that there were a lot of leaders, 50s and 60s, that were protesting the impacts of the experience that they were having here in Canada. And so, how do I go to the next slide? Oh, arrow, sorry. 400 years of Black Canadian history. So as much as I'm kind of going into the 1950s, I'm sure you all know, right? From Matthew DeCosta, I know it's not Black History Month, but we always hear about, he's the first Black that came. But this kind of represents, Nova Scotia, when the Jamaican Rooms came here in the late 1700s, right? The Reverend Josiah Benson, Marianne Shadd, the Black Loyalists, and all through Amber Valley, right? They were the first Northern all-Black community in the world, right? Northern Saskatchewan, all these areas. And every time you see Black migration in Canada, What did you see developing alongside it? Was the development of Black churches. Why is that? There was a significant role for that. And so 400 years of Black Canadian history, we see that parallel happening over time. And so right across Canada, Black Canadians have established communities, hundreds of years. And it's the Black Canadians, the Black Canadians create that places to gather and support each other. This is through the Black churches. So historically, the Black church in Canada has been a historical site for resistance when addressing issues that confront Black people. Why did they originate? In protest to racism. Narrative after narrative, when you speak, when you look way in the eastern coast of Canada to the time that I'm talking about, they will tell you they came here from Guyana, they came here from Grenada, they came here from Jamaica, and they brought their faith with them. And at that time, there wasn't a lot of Black Caribbeans, Black people here in Canada, and so they would go and join the churches that were here. And the treatment, I remember one parishioner telling me in his late 80s now, where there was an influx of immigration happening and they were kind of tolerating it. You know, they said, oh, you know, maybe when your people come, you guys could sit on that side of the church. And then it got to the point when so many started coming, they actually approached them to say, you know, we have extra facilities on this Saturday if you guys would like to. In other words, there's too many of you here. And so many of them had started to thinking about, you know, going back home. The racism was so much, and what did they do? Through those transnational relationships they had with their churches back home, started churches here. What did they do? A lot of these men and women were actually immigration points, where Canadian immigration would call them and say, when are your people here at the airport? Come get them. They'd house them, they'd clothe them, they would support them in so many undocumented ways that we don't see in scholarship. And so community engagement across boundaries. Now, it's not homogenous, right? This goes across denominations, religious practices, etc. But what we find is that the Black church has been an all-encompassing part of Black culture and identity that bears significance to the cultural, social, and psychological well-being of Black people. And so this population, as you go through historically through Black migration experience in the different waves, always experience forms of mental health in terms of how they've navigated the system and how they've been treated. Yet the populations had very little formal mental health supports, but yet within the infrastructure of the Black churches, they were helping and supporting and nurturing and making sure you're okay, et cetera. So mental health in the church's business was really launched to increase the access to mental health prevention, education, and care within Black churches. When I sat with many of the elders in the early 06, 07, around there, it was literally shocking to hear of their stories. And as I searched literature's reviews and, you know, went online into the library, I could not find any of this type of history. And so through the public health, when they did that call out for mental health, and I'm starting to see a lot of things happening, I kind of thought to myself, people are not coping very well, and we need to kind of provide some support. And my background is in social work. And so the call out went for mental health, and I wrote the fest to say, you cannot do mental health without engaging the Black churches. And so they initially agreed. And so out of that, I was able to develop a docu-film using my arts. I did some mental health monologues, I called, where I used scenarios that often persons within the Black church can relate to, and to show how some intervention is needed. And so I used art and theater and film to be used as resources so people can go back to their churches and start this dialogue. A lot of stigma, people not feeling comfortable talking about, you know, the brother that you have. And we use certain derogatory terms and they kind of push them aside. I was at a session yesterday. It's even so extreme, sometimes they're sent back home for a person to care for them. But you know, it's supports they need. It's mental health supports that they need. And so when I was doing the initiative, I know this is auto, but in Toronto, we have this. It was a great radio station. It was G98. It was the only all-Black radio station in Canada. It took years and years to lobby. And so they just lost that a couple of years, I think, during the pandemic. But while this was going on, the owner was so touched because he could relate to mental health, and they had actually dedicated an hour of airtime for people to call in, for people to start talking about, again, to try and break the stigma. So while I was doing this work before the Public Health Agency had, I had an interview that till this very day has shook me to the core. You know, these were men that were here. They came to CAD in the 60s, and I was there to talk about their experiences, how the churches have helped Black communities. And this one man who is now deceased looked at me and he says, you know, I just feel so forgotten. And they talked about some of the things they used to do, right? When immigration would raid their churches and people getting deported, them emptying their bank accounts in order to pay the lawyer fees for people to be able to get their status, but still being sent back home, right? Their own children having to give up their own beds to help facilitate, because in the 60s, 70s, 80s for the Caribbeans, that was the bulk. Mass migration was happening at this time. There wasn't the YMCA. Well, that's for Toronto. I don't know what the community agencies would be here. It was the community that was helping each other. I remember, and when I hear these words, I feel forgotten, has always kind of pushed me to ensure that these men and women are not. And to sound the alarm in academic scholarship that when we're talking about mental health and institutions that we need to engage with, the Black church must be one of those. A woman shared with me, she came here in the 1950s. She's still alive in her 90s. And I was sharing this with some people here at the conference when she was saying that she was downtown Toronto, and she was about 7.5 months pregnant, and she's going off to the doctor's office. And on her way, she sees this Black woman on the street sobbing her eyes out. Just put the picture in your head. It's 1959. There's not a lot of people that look like this. She's going to her doctor's office and she's telling me she sees this woman sobbing, goes to her, what's wrong? What happened? And the lady's like, my employer just kicked me out. I have nowhere to go. She's going to the doctor's office. She's like, okay, go down the street, turn left on Jarvis, knock on 101 and tell them I sent you. That woman ended up living with them for about 4 to 5 months until she got back on her feet. A complete stranger. Hundreds and hundreds of narrative stories like this in terms of how people were just reaching out and helping and supporting and so forth. And a lot of the legacy of that continues, especially during the pandemic. I would say we even saw that. So I feel forgotten is part of my motivation to acknowledge people like even this man, where he literally would go down to Pearson Airport with his wife and bail out those in the deportation that were there, that were held up in the immigration system, even set up an own women's shelter. And in 1963 became the first Black man from Afro-Caribbean roots to start a Black church in Toronto. I feel like that's Canadian history. Mm-hmm. And when you think about the real estate these men had, they actually purchased homes because they were finding that a lot of women were not getting supports in the shelter system, and they would purchase homes to house people. That was funded not by government, but by the institutions of the church. For me, that's history that needs to be centered, right? So this is one of the things he had said. Our church, you'd be surprised. He was talking about people that were coming here that were getting deported by Canada immigration. Our church, you'd be surprised. We got them in here by the thousands. My wife in those days, when immigration picked them up, my wife and myself, we would get down there and get them out by the dozens. This is not their family. They're not related to them. They're just fellow Black people. They want to help. We're talking about the 60s coming to the 70s. Again, this is auto, but Honest Ed's is a historical corner. Is anyone here from Toronto? So does anyone know about Honest Ed's historical site? I think it's sacrilege that they've bulldozed down that to put up condos. They would tell you in the 50s, they would write the streetcar just to meet people that look like them. going through stress and things that are happening. And they would just ride the streetcar and meet up at Honest Ed, because that's where they knew they would meet people who look like them and get that support, that sense of community, etc. And these women that didn't know each other, they ended up becoming the nurses in the hospitals. They were the ones that came here as domestic workers and went back to school. We're now, even in Ontario, they say they're some of the best nurses the Ontario systems has ever seen, Black women from the Caribbean. And so a lot of this is coming out of those experiences. Chatham, Ontario, when I went there for a tour, when you look at all their pictures, you know, Chatham is a very historical site here in Canada, home to the Black Blocs. It was like a little Wall Street. You know how they talk about Black Wall Street? Well, Chatham, Ontario, I think they're the same thing. A lot of doctors came out of that sector, but it was the Black churches that were nurturing these professionals and creating their own businesses and their own economies. There's something here to be said in terms of why we need to engage with these communities. And so mental health of the church's business, what I decided to do is just to call out a town hall and just to bring people in the Toronto area, because I remember one time on social media, I had put this thing out because I was asked to come into this church to talk about mental health. And everyone was just staring at me like I was talking about, I don't know. I just felt, when I left the room, I still felt the stares on my back. And I said to myself, this work isn't finished. This was about 2018. And when I put that out, everyone was like, we need this. And so we brought people together, and the therapists that in the Black churches came out, the social workers. And then I realized how much expertise that has not been mobilized in the context of the Black church traditions, et cetera. And so these are just pictures. I just want to show it's not research findings. See, I'm wearing my shirt. My church is the mental business. The work, some of the speakers and what was shared, you know, people who had been through certain types of trauma, and how through the community of the church, they were able to get back up on their feet and become the voice for other people who are going through this, to know that, you know what, there's hope. Because I'm telling you, in this space of mental health, if you don't operate from a philosophy of hope, it's a very empty intervention. And you see, this is what spiritual practice that, you know, I mean, scholars have written about the importance of it, but there is a part of a humanity that needs to know that there's a sense of, you know what, though my daughter, my child, what have you, is dealing with this, but through all the resources coming together, it will be well. All right, and so this is just showing you some of the activities, some of our symposium. We fed them, we talked, people cried, they shared the resources, and finding out who is doing the work. And so it was a lot of community engagement. This was an Anglican church in the North York area. It was a Black Anglican church. There's not very many of them. Again, sharing stories and just being healed. And it was just such an organic, beautiful experience, again, for them now to take it and to kind of build up their own kind of mental health services, not in terms of the way we therapists would do it, but again, that community component cannot be overlooked. I'm just looking at my, see if I'm okay here. Another symposium here over in British Columbia. Again, there's little pockets of Black churches there as well. We did a symposium there and really bringing people together. And so just sharing. This was a youth forum that we did. And so that's just a picture of that as well. And this is just the mental health monologues. This was a woman who clearly had a mental illness, but was in the church singing and dancing. So I was kind of coming from the charismatic Pentecostal, because that was the fastest growing denomination at the time of Black migration from the Caribbean. And here she was singing and dancing, and her anxiety was so high that you're wondering, now this is fictitious, but what I was trying to show was, don't you see this sometimes on a Saturday or Sunday? And then I would kind of just, you know, write the dialogue and to get people to like, yeah, right? This was another. And then this woman was, we are seeing a lot of Alzheimer's and dementia coming out in a lot of the Black churches. And when you connect and listen to their stories, you hear history of trauma that has not been dealt with over the year, that's now manifesting later on in terms of, you know, memory loss and other things. And when you really engage with it, and so I did a monologue on this as well, things that happened to her that in later life, right? And so this was just the period of time that I really wanted to share and just give a window. So when you're doing your proposals and you're writing, that you kind of consider this pocket. And I don't want to say pocket like it's a small insignificant, but has been part of the Black Afro-Caribbean Canadian experience. And so this was the mental health launch and so forth. And so I just want to share a little bit of the clip of the actual docu-film that I had done to kind of put this together for churches to use to bring out awareness and to break the stigma. Just a little clip here. All right. So using art as theater for healing is one of my ways to address mental health, where there may not be that one-on-one type of therapeutic encounter, but through a storyline. And so since 2010, I've done like hundreds of, I'm a playwright, I do these plays. Actually, this is one right now that's talking about the Black experience of what happened in the 60s. It's actually a play I have going on right now called Old School. And again, when we understand the historical significance, we can tie it into what's happening now and think about our programming. Reclaiming our histories, I think, is also part of our mental health discussion. Because when people are feeling forgotten and when they're engaging in our community resource and they have to check their faith at the door, they have to check all of that because in therapy, there's this taboo around faith. And I heard a woman this morning say, you know, you're going to talk about prayer and say, and use that as that it's not something that is sustaining people. You've already missed 50% of a lot of women that may come to us for help and support. And so there's a lot of different spiritual practices that we have to consider in terms of the mental health interventions. And I would just say that through the Black churches, it's something for consideration. And so there is a photo that somebody shared with me about 10 years ago. This was a photo taken on Bloor Street in Toronto in 1968. This is the photo. Men and women who came to this country in 1965, they were at a little storefront church on Bloor Street in Toronto. Many of them are deceased, and it was shared with me in a way I'm just like, oh my God, how amazing is this? Does the archives have this? Is Black history, you know what I'm saying? To me, this is historically significant. So what did I do? I wrote this book, The Black Church in Canada, a compendium of all their experiences, grandchildren, sisters, all of them have been sending photos to me, and I put that in a book encyclopedia. So hopefully, as that man told me in 2006, I feel forgotten. Hopefully they will not be. Mental health is a church's business. So as practitioners and educators and academics as we are, the Black church in Canada is here, alive and well from 400 years till now. And they should be considered part of our therapeutic practices of intervention and knowing that faith matters for many people. Mental health is not a death sentence. We're here to give some hope and also to kind of open up our understandings to other communities amongst us. If you want to connect with me, you can find me on Twitter. Thank you so much for listening.
Okay, thank you so much, Elaine. That was amazing. And it really, I think, spoke to a lot of folks in the room who may be working with church groups or faith leaders in the community as well. So next up, we are going to hear from Fakhruddin Ali and Marwa Tulul. They are both coming from Ottawa Public Health, and they're going to be sharing with us their experience working with the neighborhood wellness hubs, which sort of kicked off this year and have been a great initiative to bring supports and information into the community where people are gathering. So thank you for being with us.
Thank you. Hi, it's going to be a little bit hard going after such a wonderful presentation. So thank you for that. I've learned a lot that I did not know about the Black church's history in Canada. So thank you. To start, my name is Marwa Tulul, and this is Fakhruddin Ali. He's a project officer, and honestly, he's going to take the longer part of the presentation. I'm just here to talk very briefly. He's done such great work with the neighborhood wellness hubs, and I'm very proud to be his colleague. Okay. So just a very quick overview. I'm just going to go over the summary of the mental health of Ottawa's Black community. Then Fakhruddin will take us through the neighborhood approach to mental health, addictions, and substance use health. And I should have introduced the fact that we are specifically on the mental health and substance use health team at Ottawa Public Health. And then he'll go through the evaluation of our pilot project and what we're hoping to do. So very briefly, our wonderful supervisor, Health and Aden, actually was the one that spearheaded this wonderful research study that Ottawa Public Health has done around the mental health of Ottawa's Black community. We've heard throughout the last couple of days around how we are not that great at research in Canada in terms of race-based data, and that really influences the type of policies, practices, and interventions that our clients need and deserve. So that's kind of what influenced Hadan to take on this role of doing the study. So I'm going to bring this right over here. So the goal of the study was to contribute to that data and to advocate for better services for the ACB community. And it was designed to address the expansive question about the experiences of the Ottawa's ACB community in relation to mental health and their experiences with mental health services. The study was conducted in 2019. So we had 130 research participants. So as you can imagine, this was pre-COVID. So all the findings are pre-COVID results. So there may be changes in terms of the self-rated mental health or the findings that we would see post-COVID. So when looking at very high level findings, I won't go into percentages. I'm hoping that you guys will take a second after this to kind of look at the research, but we were looking at the protective factors as well as risk factors that impact the ACB community within Ottawa. And one of the most important things that were highlighted, and this is in the level of importance that they signified as participants, were employment to be a protective factor, self-care, whether that's spiritual, self-care practices, as well as physical activity or healthy eating, and strong social support. So that's with friends and with family. And when looking at risk factors, as I said, that your financial security and employment is number one, you can think that the opposite would be your main risk factor, which is unemployment and financial insecurity. And yesterday, we heard from the first presentation around discrimination and daily microaggressions and how that impacts mental health. And we saw that as one of the main risk factors as well. And lastly, social stress, and that all impacts us directly and continually. I'm going to jump right into the recommendations. I know that I don't want to say bore, but I know we had a lot of data these last couple of days. So I would love for Fakhruddin to jump into the actual hub model. But in terms of recommendations, it was, of course, collated from our participants as well as community stakeholders and how we provided these recommendations. So when you're looking at the ACB population's mental health, it's very complex, considering the structural and systemic things that we face. So our recommendations had to also be multifaceted to address those things that we face. So very overarching, you have leadership and funding, promotion and prevention, access and services, and data and research. So some things that came out of it that are specific is reducing barriers, which you've heard so many times. So that's in terms of informational barriers as well as geographical barriers. And that kind of is where our hubs kind of come into place. As well as in the study, we saw that 60% of ACB research participants cited that lack of shared identity was a barrier to accessing. So kind of reaching into the community and seeing where that representation is and providing those resources to the population, and increasing collaboration between various sectors, whether that's school, law enforcement, and workplaces, and increasing the capacity of our ACB community participants in knowledge transferring. So we, of course, as a public health unit, we are upstream, and unfortunately what we can do for the community is limited to how we could really strengthen our partners. So kind of reaching out to our ACB partners for them to be able to provide that care and make their services appropriate to the population. So without further ado, I'm going to have Fakhruddin take over.
That's hard to follow after that. Two people. So this is amazing. Thank you for having us today. So I'll go through the neighborhood wellness hub. So and the approach that we took with mental health and substance use health as well. So like why did we do neighborhood wellness hub and like what was the reason? What was the approach? So the neighborhood wellness hub it's a pilot project to ensure safe access to mental health information, resources, and services. This place-based approach of integrating mental health and substance use health support with the neighborhood will provide support directly where people live. So the neighborhoods, the hubs are neighborhoods where people play, learn, live, and where we can reduce barriers, whether that's through language, basically location, making it easy access for them. So we are in 5 locations throughout the city of Ottawa. The goal is to improve mental health across the life span, increase help seeking, increase access to culturally appropriate support, build capacity services by providing reaching out racialized communities. And also to increase short-term and long-term counseling. We've been we're partner with, I'll talk about partnership later on, but we're partners with Ottawa Black Mental Health Coalition, the Community Social Service Department, the Access MHA with the Royal, all of those stuff. I'll get on to that. So the reason, okay, why are we doing this? So aside from our health unit response to the pandemic in terms of managing and monitoring COVID-19 cases in the community and ensuring timely communication of the public health measures, we also have been very active in mental health promotion, suicide prevention, and substance use health alongside with other partners, many partners, including ACB partners, school boards, agencies delivering mental health and addiction services. So as you know, prior to the pandemic, we all have seen issues related to mental health and substance use health in Ottawa residents. And unfortunately, many of these issues have gotten worsened during the pandemic. So underlining the social determinant of health, such as racism, income, housing, employment, are also impacts of mental health well-being of racialized community, including discrimination, stigma, language, and so on in our community. So, and then we thought about it, so how are we gonna implement this into the neighborhood wellness hub? So one of the things that we did was we trained Ottawa Public Health staff and community in stigma and language, basically mental health literacy and resources to give it to them. Capacity building through community organization, working with fifth quintile neighborhood. Also, we've been partnered with Royal that gave us access to Counseling Connect, Access MHA. We've been partnered with Upstream Ottawa, Employment Social Services as well from the City of Ottawa. All of these neighborhoods have OPH staff at the location to provide tips and strategies to deal with mental health. So some of the partners that we've worked with is, as you can see, it's growing. So this is just from April to June. So it's just a pilot, but it has grown. So the roles that these partners play, so Ottawa Public Health is there at every location once a week, answering questions on mental health and substance use health. They're there to answer have a meaningful conversation about reducing the risk of poor mental health, which includes the stigma and not getting the help early and not knowing where to get supports from. Also, we help residents with referrals by booking short-term counseling through Counseling Connect and accessing referrals through Access MHA and One Call, One Click. Another partner that we had was Employment Social Services. So Employment Social Services outreach mobile team is from the city of Ottawa, had one caseworker at Albion Hetherington and Rideau Rockcliffe. So that's the two community center in one of the locations to provide support and access to social assistance program, including financial assistance, housing, training, and referrals to Ontario Works and other subsidies. Another one that we partnered up was Upstream Ottawa. So Upstream Ottawa, they were at two locations with the Boys and Girls Club. So Upstream Ottawa, basically, were there Tuesdays and Thursdays at two different locations. So the Maurier and McCann. So Upstream ACB social worker from substance abuse program for African, Canadian, Caribbean youth called Pronounced Apathy, provides mental health and substance use services for Black youth age 12 to 29. And their families or caregivers. So also Upstream Ottawa did a group information session using variety approach and interventions. And if a youth or someone didn't want to get help when we were there, you can get a session outside, like with Upstream Ottawa. And then how did we come up with these locations? So with the locations we came up with was not only with us, but we had a consultation with our community partners working in the areas. Many of the locations previously were vaccine hubs. So right now, there's still two locations that still provide vaccination. So they still do vaccine at the two hubs. So the locations that we were at is Albion Hetherington, Rideau Rockcliffe, Bellevue Community Center, Ron Colbis, and Don McCann. So those were the locations, and the vaccine is still happening at the two locations is Bellevue and Rideau Rockcliffe. So they still have a vaccination there. And then this is our flyer that we kind of hand out to the community. So it shows of the time, the location, and what programs that are there to serve the community. So if, let's say, you want to go to Rideau Rockcliffe, then you'll go, and then you'll see what services that are there that can help you, okay? And then finally, if we get to the evaluation. So for our evaluation, as you know, the first 6 weeks, it takes time to build the momentum. So there has been a lot of engagement with the community and with partners. We're also having meaningful conversation with residents in these locations. We're building trust with the community. And that's one of the key things. When I took on this project, one of the things that I wanted was I just didn't want a pilot project just to come to a community and then they're gone the following 6 months. So we wanted to stay there so we can build trust and continue to be there for the several months, whether it is years from now or for a while. So the wellness hubs, it's very different in the sense that we need to give residents ample time to speak with us and share the challenges and how we can support them, whether that's through strategies, through giving them tips on mental health, or if they just want to talk to somebody. Because a lot of the people that come to the hubs just want to talk to somebody. They might not have someone to speak to at home, or they've just been through a lot during this pandemic, so they just want to speak to somebody. Sometimes the conversation goes from 20 minutes long to sometimes being 40 minutes long, all depending on how the person, when they arrive. So are they distressed? Are they nervous? Like, you know, do they just want to talk to somebody about something? So it all depends. And sometimes, honestly, we get people that just come in that just say, thank you for being here. And they're there for 2 to 5 minutes and they're gone. So when we looked at this evaluation from just April to June, and I know that this week, the past couple of days, there's a lot of data going around, but we had 380 meaningful interaction with the community, 150 with building capacity training, and 10 with referrals. With 10 referrals through Counseling Connect. Also, just the community partners and the community in that neighborhood make this possible for it to work. Like, we can't do this neighborhood wellness hub without the community and the partners that work in those areas. So we just want to thank and take the time to thank them. And I'll just end with what the doctor said earlier. What makes community is community helping each other. So just being there and working together. So, and thank you.
All right. Thank you so much, Marwa and Fakhruddin. It's been really wonderful to have the opportunity to work with Ottawa Public Health on the neighborhood wellness hubs. If you would like more information about that, please feel free to connect with Fakhruddin and Marwa after the session, as well as take a look at the tables outside. You can pick up some information and some flyers around the work that OPH is doing in the community. So next up, we have Papalajike Diouf, a psychotherapist and clinical supervisor, as well as Jacqueline Saint-Laurent, a PhD candidate and supervisor as well, who will be presenting on the Ottawa Black Mental Health Coalition's Community of Practice, and also colleagues of mine. So enjoy.
And the down arrow. Okay, so last group, we're almost there. Just, stick with us a little bit longer. And then we can all sing and dance together and celebrate. Okay, so hi everybody, my name is Jacqueline Saint-Laurent. I'm a researcher, PhD candidate. Some of my research interests are human sexuality, suicide prevention, mental health for our Black community here. And I would like to also introduce Papalajike Diouf, who is doing amazing work in our community. And he will start us off with this presentation. You've heard about neighborhood hubs. So we're like the continuing branch of that presentation.
Merci, Jacqueline. Thank you so much. Hi, everyone. Sometimes I will switch from French to English because my brain sometimes I'm a francophone, and trying to be bilingual. So it will be sometimes switching from French to English. So my name is Papalajike Diouf. So as I said, I'm an immigrant for the première génération. Okay, as we said, and knowing all the process of immigration, integration, and all the trauma around the process, and working with communities in immigration and seeing the intersectionality And when we are talking about mental health, sometimes we are just thinking that it's trauma is a big thing arriving in your life one time. No, it's a big mistake. And sometimes we exclude some people because of that comprehension of trauma. And the reason here about creating Ottawa Black Mental Health Coalition and thinking about how we can bring all those expertise in the same table, thinking about how we can help our communities. It comes from a great discussion between me and Susan Obiora, who is right now director in EDI at the City of Ottawa. And we were thinking about why we as leaders around this table, strategic table of addiction mental health, we are just two people here from our communities. So, and we try to raise our voices sometimes to say, hey, you know what? There is a big, big, big gap in the system when we are talking about ACB communities and addiction mental health around the province. So it's the beginning of Ottawa Black Mental Health Coalition in the idea. And we try to just have our community, our leaders, and our, les travailleurs de terrain with us. And we are growing, we still are growing at Ottawa Black Mental Health Coalition, but we are proud to just have the opportunity to build a community of practitioners. Right now, we have a community of practitioners, and we have the opportunity to work with researchers as Professor Jude Maricena, who is at the, qui est l'instigateur de ce qui nous rassemble ici. We have other researchers, but we have practitioners of experience. My sister Jacqueline and others who are clinicians, but clinical supervisors, in universities. And we have with us clinicians who are with the clients 24 hours. And we have people with lived experience with us. Because for a long time, we had the approach of experts. And I really appreciate what my sister from the church, share with us. I think that right now, it's the biggest barrier we have is that mental health, addiction, concurrent disorders are just in the hands of those we call professionals. We need to democratize, I said it in French, and just understand that we need to have champions. If we want to go through stigma, because it's the biggest barrier we have, stigma. So we need champions from our communities, people living with lived experience, families, friends in our communities. So here is what brings us to think about how we can work in access, because access is the biggest barrier in our communities. And we have some internal causes, but we have external causes. So the internal causes come from some lack of education. Sometimes people talk about taboo. I'm not just agree every time that we talk about taboo. working with communities bring me to understand that sometimes they understand mental health in another way. They have another comprehension of mental health. And if we bring the Occidental comprehension, we block, the relation and the capacity to talk about, mental health. So here is one of the barriers we have in our communities. So it's just not about taboo sometimes. So the external one is about discrimination. And it's about a culture of discrimination, a history of discrimination. And it's related to what we call institutional and systemic racism. It's related to that, So it brings us to just, as clinician, I'm not a politician, I'm a clinician. So my goal here is how my experience and my expertise can be useful for those who are working with clients and for clients. And with Jacqueline, Shannon Black, and other members of the community, and Jude Marie Sena, we think about how we can create a peer support group, and how we can support by supervising those clinicians who are working with clients from our communities, because in our universities, we are trained with a model for some communities. So we are struggling right now as clinicians for tools. If I have clinicians here, I can just ask, the tools you are using with communities are tools think for a majority. And we have to adapt that. How we can do that? It's why we had this opportunity to create a group of clinicians, to create the opportunity of peer support, and to create an opportunity for clinical supervision. So we have every month, and I'll finish with that, I think. I think that the first barrier we have is funding. We struggle to have funding to just, maintain, create, and maintain and have quality, because it's just not a matter of creating something. We deserve to have quality in what we offer to our communities and to our clients. So thank you so much. And yeah.
Oh, Lord, I was hoping he was just going to continue and I could just stand here and look pretty, and just enjoy the conversation. Okay, so, Papal Educate was talking about the peer support mentorship and the clinical mentorship group, and I was part of that group. And honestly, I joined for very selfish reasons. Okay, so I'll talk about my own experience of being one of the clinicians that was helping other clinicians. So as Papal Educate Diop mentioned, I have my master's degree. I'm a psychotherapist here. I have my private practice, but honestly, I did not know how to provide culturally sensitive therapy with my own people. And for me, that was a very big issue, right? So when Michelle called me and said, hey, Jacqueline, you're bilingual, right? And, would you be part of this peer support supervisor consulting? It's going to be with Dr. Sinat. I said, absolutely. I really enjoyed Dr. Sinat. He's very resourceful. Let me leverage this, right? And train myself, right? So that way I wouldn't have to do another PhD or master's and spend $100 million, right? So let's just, so I wanted something a lot more closer to me that I could understand, right? But it also meant extra hours. It also meant a lot of readings, and we laughed and we cried together, right? And then we brought it back to our communities and created a 4 months, once a month group where racialized clinician could come, ask questions, and just feel part of something, right? And a sense of belonging, and just share some of the tools that we don't see and we don't hear of when we're doing our master's degree or our PhD degree, right? So it was very selfish of me of saying yes, but at the same time, I made sure to give back, right? So 4 topics that were discussed were the following. Is it in the presentation? Yes, right? So one of the topic was racism, countertransference, and racial discrimination, culturally adaptability of assessment tools in trauma, crisis, and suicide prevention, mental health and sexual health literacy, and the therapeutic alliance. So how did we come about to choose these topics? And again, it was really for selfish reasons, because I am a PhD candidate and my research is in human sexuality. So I said, okay, how can I leverage this? So I'm going to use what I already have, with the help of Papa Lajiki and Dr. Sunat and Shannon Black. And it was also something that we see that was missing in the community, right? When we talk about sexual health for racialized community as well. Racism countertransference. Why did we choose this topic? Again, there's a lot of internal racial biases, right? And even if you're not a racialized clinician, you're going to have racialized clients, right? And vice versa, right, as well. So we're racialized clinicians, and then we can also have, non-racialized people, right? So we also have to be able to provide the tools for them as well. And we've also noticed we're both teachers and we're both clinical supervisors. And something that we've noticed is that in the students' training, when they were seeing non-racialized clients, they were also victim of discrimination and racism by the client. And we've noticed that the schools didn't have any policies to help our students when faced with those issues within a session, right? So it's something that we try to also address. What do we do with that? Right? That was also a very big component, and also racism and discrimination in class. What do we do with that? How do we address it? Mental health and sexual health literacy. This is my background. I love it. It's also something that is much needed. We talked about taboo, mental health taboo. There's a sexual taboo as well in our racialized communities, right? What do we do? And yet they come and they may not use the word sex, right? They're going to use intimacy. They're going to use, self-esteem, lack of confidence, partner issues and stuff like that. But there is also a sexual component. So how do we better educate our mental health providers to talk about sexual component and intimacy with the clients, right? And especially racialized clients. And the last one, which I think is the most important one, is therapeutic alliance, right? We are relational beings. We communicate in a relational way, right? It could be with words, it could be with our body, it could be how we choose to share food, right? So how can we work on the therapeutic alliance, but that resonates with our communities? Because the way that we're teaching therapeutic alliance right now, it's not working for our communities, right? And in the word of, what was the author? Kenneth Hardy, I think his name is. And he said, I've learned to be a very good white therapist. And that is also what I've learned. But I haven't learned to be a therapist for my community, right? So what does therapeutic alliance look like working with racialized people? And I've noticed that I really had to change my approach. I really had to change my ways working with our community, right? Even, for example, the consent form, right? And there was a lady that mentioned it. What is consent for a racialized community? When you're a newcomer and you're already signing so many documents that you don't even know what it means, right? And then you go to therapy and we're giving you another document, that says everything is confidential, but I have to mention it's only confidential if there's these 4 elements. What does that mean for a community, right? And then they sign it, and then I realize, do they really understand what they're signing? Do we understand what we're telling them, right? And yesterday we had a presentation with Children Aid Society, right? And how the representation of racialized people are highly represented, right? So this all ties into therapeutic alliance, and just the consent form. So we started with these 4 topics. It's a pilot project. It went really well. So hopefully we can continue it, get more funding, and get more people involved as well, right? And another selfish reason that I decided to join is because I didn't know where my people were, right? When I teach students, there's a few racialized students in my master's program, but I don't see them afterwards. I'm always looking for them. Where are they? Their name are not mentioned, right? So starting this peer support group is also helping the students that want to further their career as well. And I also really benefited from it, opening my own private practice, networking, and just feel a sense of belonging and a sense of being part of something that is bigger than myself for our communities. So these are 2 quotes from participants that they mentioned. And now I have a bigger network. I have more tools that we can share. And it was a very, very fun experience. I do recommend it. And we're going to do it again. And you're all invited. So I'm doing some promotions right now. Yeah. So a community of practice, a few considerations. These are the questions. Oh, sorry, Michelle.
You can just
Yeah. Okay. So I'm gonna start. I'm like, okay, I still have time. Okay. Yeah. So a few considerations. What is the genesis for the community of practice? There's a few things that I mentioned. So what do you have to consider when creating something like that for your own organization? It is important to have the support of the senior leadership team, right? They really need to back you up. One thing that I've noticed when I was part of it, it's time consuming. I bought the books myself. I took time after work to read. The sessions were done after work as well. So it wasn't something that was integrated and part of my everyday work, right? But I did have amazing support from my director at the time, who's actually here. So she's continuously showing some support. And this is an example of good leadership. For example, I ran with her with an idea and she said, yes, go for it. So these are a few things that you need to consider as well. And it's an emotional work, right? It did have an impact on me. Yesterday, Dr. King was mentioning my experience of realizing I was Black. And it resonated with me. And while we were creating, the community of practice, I realized, oh my goodness, I am Black. I am a Black woman. All these challenges I faced them, but I didn't have words. I didn't have the tools to understand them. And being part of that community of practice gave me that safe space, that courageous space to talk about difficult topics and talk about difficult issues. And one thing that we didn't really touch on is the churches, and I think it's something that we need to integrate next time. The next round that we're doing is how to involve churches as well. Yeah. Okay. I'm going to stop here before I can talk all day. So Michelle.
Thank you so much for both. All right. Thank you so much, Papa Lajike and Jacqueline Saint Laurent. Merci. For sharing the community of practice. As you can see, there's some information here, and feel free to connect with both of them if you have, if you want to after the session. So now that we've heard from all of our presenters, we're going to have a little bit of a question period. So this is sort of your turn to shine and to ask questions. As I mentioned earlier, we have two lovely volunteers who will bring the mic to you. And I see that we have a question over here to start us off. Yeah, and I'll ask all of our presenters to come up to the front and grab a seat at the table so that everyone can see your beautiful faces when you're responding.
Yeah, can I start?
So yes, if you want to get started. Sure.
Okay, thank you so much. It's such a fantastic presentation, and I have a couple of questions. One is for Dr. Elaine, and my second question will be for the Ottawa Public Health team. So my question for Dr. Elaine is, what was the first impression or the first response when you started this initiative in the church? Because I've worked on a couple of projects that involve the Black church and other religious leaders around HIV, which is again another stigmatizing and the topic that people are really reluctant to talk about. And there was a kind of challenge, but in the end, we were really successful in working with Black religious leaders. So what was their response initially? And do you have any plan of probably expanding your area and reach out to other religious leaders other than Christianity? That is my question for you. And for the public health team, earlier today, we were talking about accessibility and how people access these available services. And I know most of our Black folks know the services are there, but sometimes they are reluctant to use, and some of them do not even know. So how are you promoting these services so that you can really reach out to the wider Black folks? Thank you.
I was waiting for my big mic. So there's a particular, I think that, in research, when we talk about the insider outsider, I feel that oftentimes when the churches, Black churches, are approached by government leads and external organizations, it comes with, you coming to survey us? Or there's this kind of initial, what is this about kind of thing. Mental health, there's a lot of stigma around it, and a lot of leaders have their perspective on how it should be dealt with. And so this is why I used art and theater. Hey, come to my show, right? You're going to laugh a little, but then I'd hit them with someone that's dealing with trauma, and you know what I mean, that I nestle within my storylines and stuff like that. But when I came out with mental health, it was literally overwhelming. I couldn't believe how much outcry there was for this work, because people just didn't know where to go, and they wanted to do it within the infrastructure of the churches, who has the professionals there, who faith is centered. And so it was actually very overwhelming. And sadly, I didn't get part 2 of the funding to expand it through public health. So if they're in the room, yeah, because I have a lot of ideas around even the interconnections because as I'm learning in Muslim women experiences is almost in parallel to what I'm hearing, right? But I don't have expertise in that. So I see collaboration with other non-Christian churches, not churches that would be like, thank you. Thank you for the question, though, because I think more and more, I think what we're hearing is that we have to address this more and more. And if you are approaching, I would say, the mosques, the churches, right, there has to be a respect. there has to be a respect for their teachings, how, you know what I mean? Even though you're interrogating some things. And I think sometimes that's what the instance is about. Like, are you coming to tell us to change everything that we are for 1,000 years? Or not to say that there's nothing to be critiqued, but you know what I mean? And I think that that's the approach, I think, for community members who want to get data from these groups. It has to be done from a lot of sensitivity. And you're probably best to maybe, coordinate with someone within that also knows that mental health is something that needs to be dealt with and work from within, and then make those external connections. That would be my recommendation on that.
To answer your question on promotion we did for the Neighborhood Wellness Hub. So some of the things that we've used is, I had a bigger slide, but once I was told 15 minutes, I had to cut some stuff down. So we actually had a video promotional for our Neighborhood Wellness Hub, and it shows all the areas that we're at when you come in, your experience of going through the whole system. But we are using YouTube, we are using Twitter, we are using our partners to put the word out. And we do have a community engagement team on our Ottawa Public Health who actually work out of these neighborhoods. They actually go with partners to door and actually put some flyers out. So we're actually doing it through Twitter, emails, video, and door-to-door knocking. So
I'm just going to add one more thing. Even though he does all of it, it's not me. They go to a lot of events as well within the community. So with our partnerships, we find out of events that's happening within the city, and we usually get a table at those events. And that way we could also further promote like the neighborhood wellness. We also have other resources on our website, like Have That Talk, and that kind of furthers a conversation. And we network with other ACB groups that we haven't been connected with to then start supporting them as well.
Rob, we're going to hear from this side, and then I think we got another person over here to go next.
Great, thanks. I think folks have heard from me a lot. I'm Robin of the 613-819 Black Hub. I have two questions, and I'd like them answered in the reverse order that I asked them. The first one's for Marwa. You mentioned that one of the solutions people were looking at was increased collaboration with law enforcement. So I'm just curious what that means. And then the second question is for you, Michelle, and would have been for Papa. Did he leave?
No, he's there.
Excellent. Hello there, Papa. Good to meet in person. I'm good, I'm good. So the question is, so we're at a Black Mental Health Conference, and again, I didn't hear anything about police in this presentation. So of course, Michelle, you're actually, first of all, I want to say thank you to the Ottawa Black Mental Health Coalition for being one of the supporters of this conference. So that's excellent. I am a big believer in praising our leaders when they do good stuff, but also calling them out when there's omissions. The Ottawa Black Mental Health Coalition does not have a stated position on, like publicly on police abolition, right? But a lot of your actions show you're probably police reformists, right? You're part of the Mental Health Guiding Council, which is both created by the police and has police on it, and is working towards a system, an alternative system, supposedly, that will have police coming, and this is from their own terms of reference, when there's criminal activity present, which if you think of Abdi, that he would end up dead under that new system. So there are people who would say that being a police reformist organization and being an organization that purports to do things for or be careful about people's mental health is a direct contradiction. One of the people I'm talking about is activist and police abolitionist Elle Jones. And I know she believes this because I asked her this morning. So I have two questions. One, what is the position of the coalition? Are you reformist or abolitionist? And you can either be one or the other. And if you're reformist, do you agree with that idea that's a contradiction?
I'll quickly do the easy question. Sorry. But in terms of law enforcement from the recommendations, it was around working with ACB communities in collaboration with them to develop anti-racist policies in schools, as well as law enforcement and such. Currently, we haven't gotten to that part of the research, or not research, but recommendations. So in 2023, we're very proud to have now an ACB part of our team in the mental health team. So it's about 5 of us or 6 of us that are now on the team. So we're pushing a new strategy for 2023, and I'll for sure take that back to my supervisor and kind of chat about how we can further explore that.
Take turns.
So thank you so much. Hi, Robin. Yeah. Right now we have kind of we participate at the conversation around the table to just not to be aware of that or just être en dehors de ça. Okay. So we understand that it's the time that we can have another approach. And the approach here for us is, even in the past, you decided for us. It's time to decide with us. And we need to be around all those strategic tables to see what you are talking about concerning us and how you are talking on those realities for us. And the position right now of the coalition is to be at all those strategic tables where they decided for our communities. On ne veut plus laisser des chaises vides autour des tables. Parce que pendant longtemps, ça ne nous a pas servi. So aujourd'hui, nous devons être là où il faut être. Même si nous ne sommes pas d'accord, nous dirons, nous ne sommes pas d'accord sur ça. Mais il est temps qu'on arrête de laisser des chaises vides et qu'on décide à notre place. Fait que here is the main philosophy of the coalition. Michelle, I don't know if you have something to add.
I don't think I can add anything other than to say that at the end of the day, the Ottawa Black Mental Health Coalition is a mental health organization. And that means that we are interested and invested in anything that has to do with our mental health. And if there are tables where that is being discussed, as Papa Lechike said, then it's really important that we be there, because if we're not there, how can we have our say? And as a coalition, we decided as a group that it was important for us to be at that table. And it is an important part of our work to ensure that mental health services improve for our community. Because at the end of the day, nothing will bring my brother back to life. Nothing. But if I can help somebody else's brother or sister or mother have better care, more compassionate care, we can do better than this, guys. We can do better than this. And that's what the coalition is trying to do wherever those discussions are happening. And I think it's important to acknowledge the folks that are sitting at those tables, because it's not easy. These are difficult conversations that we have to have, but somebody has to have those conversations. And so the only way to do that is to be at that table and to be part of that dialogue. And I'm very proud of the work that the coalition has done at all of the tables that we sit at and all of the places and spaces where we are advocating for ourselves and for you. I hope that answers your question, Robert. We're going to pass it to the next person.
So I have to go because I'm at the round table for this conference. So I have to go. Just share with you a last thing. Yesterday, I had a training with women leaders, feminist women leaders. And I was asking about allies. And one of them said, I don't want men around my table because those men I had around my table, they came and they wanted to take the place of men. I said, you know what? Those allies coming with us, they come with their culture. Those men trying to help the cause of feminism, they have the intention, but they come with a culture of patriarchy. It's not in 2 days or 3 days that change. It's you to help them understand that now it will, on n'a pas besoin de sauveurs, on n'a pas besoin de personnes qui viennent nous sauver. On a besoin de gens qui viennent travailler avec nous pour nos propres besoins. So here is my understanding of how we can change things with real allies. Thank you so much.
Thank you, Papa Lajike. Okay, we have time for one more question. Okay, I see there at the back, you've got the mic. Go ahead.
Yes, thank you so much.
Sorry, this person was first, actually, even I think Robin, and then we'll go to you after.
Thank you so much for all that you have shared with us today. Please bear with me. This question has been in formulation for years, and I think some of what I've heard throughout this conference has helped me tailor in what I'm trying to ask. So many of us in this room are doing a lot of work within systems that have harmed the people that we want to help the most, those that look like us. And in a lot of the work that I do, we are working from a multi-pronged approach to provide a system of services that support the Black community. Many of the folks that we are supporting are coming in with layers of trauma. And one of the difficulties with working with trauma in these systems is that trauma first, it shatters meaning. It creates needs, particularly justice needs. And one of the vessels for healing is storytelling. One of the challenges that I have as a clinician is working around some of the regulatory bodies' ethical and practice standards of practice when adapting some of these tools and making sure that what I am offering to folks is culturally affirming. I know we don't have much time, but I would be really curious to hear Dr. Elaine Brown, what does, with some of these considerations and the mistrust that has been created as a part of being in these systems, what can culturally affirming support look like with these considerations?
Oh, sorry.
What would culturally affirming sports look like? You got $10 million? I could show you. I'm kidding. That's. I don't have the answer to that. But what I want to say though is that I think that I heard someone say I think we have to begin to contest some of the traditional ways of intervention in our communities and kind of value that people don't use the language of mental health, but they're doing the work. And they've helped a lot of people. There was a man that told me about how he was cheated. He was an immigrant to Canada from the West Indies, and he wanted to buy a home. Long story short, real estate agent told him, "We got a home for you. This is the Canadian dream." He bought the home, and and signed on the dotted line, and he got his house. And a year later, someone knocked on the door and said, "Excuse me, sir, you need to vacate." He's like, "What are you talking about? My brethren helped me. You know what I mean? I got the house." No, well, it was actually fraud, sir, that you were, yeah. He lost the house, he lost everything. And he told me that he planned to murder the guy. Everything in place, going to murder him. But a friend had said, hey, I want to invite you to a baby blessing at this Black church. Would you believe that Sunday, the man that was going to go murder someone else, because he heard something that sounded like something that he could grab onto to say, maybe I should go murder the man. You know what I mean? And that changed the course of his life. Now, it wasn't a counselor, it wasn't a probation to be officer. It was just something that affirmed him as a man to say, maybe it's kind of like what I heard that gentleman say yesterday, you know, first degree murder or you're being arrested for assault. There's a little bit of hope in life that maybe, you know what I'm saying, as opposed to being, that was the session yesterday. And I think it's just thinking about other ways of how people are coping through tragedies and so forth, and find out what their world is, and as opposed to what just the textbook says. Now, I'm an academic, I'm not telling no one to read the textbook, you know what I'm saying? But you're saying culturally affirming, and I think we're hearing that over the last 3 days, that there are different ways. There are sacred spaces where people are being affirmed to cope with this ongoing trauma. You're a university student and you're Black in Toronto, you've experienced some type of crazy trauma in terms of in our education systems in Toronto, where almost half of our Black kids have dropped out. You better have something to counter that outside, or else the streets will. You know what I'm saying? So kind of thinking and exploring. So long story, I don't have an answer, but that's just kind of my little philosophical
All right. Thank you so much, everyone. Unfortunately, the roundtable discussion is about to begin, and we definitely don't want you to miss that.